I'm Elizabeth Braga. I'm a physiotherapist and I work for the MSF Foundation as the rehab specialist for women's health. In the three main intervention areas in women's health that MSF has been dedicating itself to, we can distinguish the perinatal period, breast cancer and cervical cancer, and also huge intervention in sexual violence. All these three can prone women to physical disabilities if not timely and properly addressed. At the top of women's health disabilities, we find urinary incontinence, nevertheless, pelvic chronic pain, other forms of incontinence, and problems with sexuality. During my visit in Jahun is a small city in northern Nigeria. What I found was a very well-established project that is over 15 years old. The hospital maternity receives essentially very complex obstetric cases. So we find women that are pregnant and that are severely ill, not necessarily related to the pregnancy itself, but also. And also women that undergo complications during delivery, of which one of the most common, unfortunately, in this region are the obstetric fistulas. So what we find among this population are physical disabilities that can be short or long-term, but eventually they tend to be long-term or lifelong if not addressed by physiotherapy. Our aim is to bring a more complete notion of what physiotherapy, of what rehabilitation should mean applied to women's health, and with the particularities of these pelvic conditions that women tend to present here, to educate the patients, but also the nurses, the medical doctors, the surgeons, and hopefully very soon the physiotherapy team that will be managing these patients. So our next steps will bring us to Blantyre in Malawi, where MSF is running a cervical cancer project. The physiotherapy activities were already implemented roughly 2 years ago in this setting. The core of practice in terms of rehabilitation is very centered in pelvic health. My action in the project is to support the already existing activities, more specifically the dedicated professionals that are developing rehabilitation in the project. A question that I'm often asked is how difficult is it to bring women to talk about an area that is so intimate, like their pelvic health symptoms, and especially in some of the settings where we operate within MSF, they will not easily disclose in a very spontaneous way, but once we pose the question in a quite compassionate but very direct way, they are very keen to share, and with an incredible level of detail about their issues, their problems, and how much this affects their lives at a personal, family, and community level. The women that I met in Jahun, as part of the cohort of patients that are seen at the hospital, are a proof of strength